Hello, and welcome to another Facebook Live broadcast with MedStar Health. My name is Sarah Ridenauer, and I'm joined today by Dr. Erin Hansen, internal medicine physician with MedStar Health Primary Care. Today, we'll discuss finding and establishing a primary care provider, the relationship, the benefits that you can have with having a relationship with your primary care provider, and more. So stay tuned. If you're interested to learn more, give us a like to let us know you're watching. Share this broadcast with your friends. And if you have any questions for Dr. Hansen, please leave those questions in the comments below, and we'll do our best to answer them. Before we get into some of these questions, Dr. Hansen, first of all, thank you for joining us. We appreciate you taking time out of your day to be here. Can you share a little bit of your background with us, how you got working here with MedStar Health and what you do?
No, thank you. It's a pleasure to be here, and good afternoon to everyone who's joined us. I am dual trained in actually both internal medicine and emergency medicine. And I came to medicine actually a little later in life. I was a career change from public health, which I had done in the past. I worked in reproductive health. And this is my job right out of residency. I trained up at Christiana Care in Delaware, and then I came to join MedStar after residency. And I've been working with the MedStar Medical Group Bel Air office, and I also do teaching. I work with the internal medicine residents down at Franklin Square 1 week out of every month, teaching in their continuity clinic, which has been just very rewarding as well.
Awesome. That's great to hear. Thank you again for joining us. So let's get into the questions. First of all, who should have a primary care provider, and what is the role of a primary care provider?
Great questions. I would say that everybody should have a primary care provider, and that includes even our little children. We're going to focus more on adults today, but we call them pediatricians often, but they're functioning in the role of primary care as well. So I would say that everyone out there should have a primary care physician. And here's a few reasons, which gets into the other question of what is our role in care. So I view us as sort of the home base for healthcare. We can always be your go-to person, whether it's that you think you're getting sick, have a concern about a chronic illness, etc. We can be your go-to people. And we are responsible for making sure that people are kept up to date on all of their preventive health screenings, screen for chronic diseases and diagnose chronic diseases, manage chronic diseases as long as there's nothing too complicated, and then having that knowledge of when do we refer you to a specialist, when do you need to go see someone with additional expertise. In addition, if you think you're getting sick, think you have COVID or a urinary tract infection, think you have an abscess, we can manage those types of conditions in the office. We can do preoperative evaluations for people who need surgery. And then finally, sometimes people have a lot of medical problems and they see a number of specialists. So one of the big roles, key roles that we have is sort of being the person who takes the bird's eye view of somebody's chronic health problems. So that way, if one specialist changes the medicine, another specialist changes it back, and we can kind of get people together, have those conversations, make sure everybody knows what everybody else is doing, and that one person who's looking at the broad picture of someone's health. So we can function in so many roles. And the other thing that's nice is to have that doctor that really knows you, and that will be aware of your history, and that you can always go to no matter what the concern is. So we do so much, and it's really a joy to be able to practice with such a broad area of practice.
Yeah, I was going to say, it sounds like you do a little bit of everything, and it's a good, like you said, a good focal point for someone to have as a patient. And so speaking of that, what are some factors to consider when looking for a primary care provider so that you can have that relationship with them?
Right. So I think, first of all, thinking about different types of primary care providers and what might be the best fit for your situation. And I can briefly get into, if it's okay, the different types of primary care providers for adults, because that might help. So in terms of the physicians who practice primary care, the main people are internal medicine physicians or internists, which is what I am, and then family physicians. And our training is very similar, but there are some differences. So we certainly all do preventive health, pre-ops, chronic disease management, and everything. But family physicians, actually their training encompasses newborns all the way through, the 80s, 90s, et cetera, through the entire lifespan. Some of them actually even do prenatal care and obstetric care, although that's not universal. They, in their training, spend a little more time in the office than an internist might, although we do a substantial amount of ambulatory or outpatient training. But they also have that additional training in obstetrics and child care for children and everything. So that's one option. And then the internists, I would say, again, we do a lot of outpatient training, but we also spend a lot of time in the hospital as well. So we have a very good understanding of hospital-based care. Internally, we go through a lot of ICU training, intensive care unit, and we really work a lot with the subspecialists. So we get that additional education and training in those, endocrinology and neurology and all of those specialized areas. And then in addition to the physicians as nurse practitioners, or sometimes physician associates as well, or what used to be called physician assistants. And they are also part of the primary care team as well. And so that's another option. The training is a little bit different because they started off, in the case of nurse practitioners, nurses, and then did additional training to be able to practice as a nurse practitioner, but generally the same type of scope of practice that we have as physicians. So thinking through what type, if you felt like it was important for you that your entire family be able to see the same doctor, including young children, then a family physician might be the best person. If you really wanted your doctor to be able to do obstetric care, then family physician. Otherwise, I think, both specialties, there's a lot of overlap in between us. So both options are great. So thinking about, do you want to see a doctor? Do you want to see a nurse practitioner? And then if you had a preference in terms of our areas of specialization. And then beyond that, thinking about personality fit. So as you meet someone, of course, it takes some time to develop that rapport and feel comfortable, but do you feel like it was a good personality fit? Because we're all very different and have different personalities. Some people want a very straight, let's get down to business, not a lot of small chit chat, that kind of person. Other people want somebody who's a little more chatty and talks about, family and things like that. So it's important to feel comfortable and feel that you have that relationship. Would you feel comfortable sharing with them personal issues? Because that's important. We want to hear about all of the concerns. And then do you feel like their practice style is in line with your values? So if you're someone, for example, who likes to do a medicine and holistic medicine, is that doctor provider accepting of that, or will they work with you for that? In terms of prescribing medications, is that in line with what you want to do? So I think the big thing is how you feel during the visit. And do you feel like they have addressed your concerns or made arrangements for addressing more of them in the future? Do you feel comfortable with the plan? Do you feel like you had a say in the plan that was proposed at the end of the appointment? So personality fits go a long way in terms of having that long-term relationship. If it's important to you, I think all of us are happy to share about our backgrounds. I think in terms of practices, will you be able to get in a timely manner if an issue arises? Is the provider accessible for questions in between visits? I think an interesting question to ask somebody might be, how do they keep up with the medical literature and with all the latest advances? I think that's a really great question to ask somebody, so that that they're interested in making sure they keep up to date.
Yeah, that's all really good information. I know, me personally, when I've gone to the doctor, you kind of think like, oh, well, this is the doctor, I'm supposed to see this doctor. But like you said, you can find someone that you mesh with personality wise, and there's a bunch of different doctors out there that could be the right fit for you. You don't have to settle with that one that you first went to or whatever. And so my next question, open enrollment, it occurs in October through December. Why is that a good time to establish a relationship with a primary care provider? And how can you work with your primary care provider to set health goals?
No, that's a great time because, of course, you're thinking about, what your insurance plan is and who is accepting your insurance. So that way you can work in a way that's going to be financially effective and also within the system that your insurance participates with. I think that as you go and meet your primary care doctor, you want to be sure, I think it's helpful, and I love it when my patients come in with their concerns written down, and that way they don't forget things, and we can sort of triage their concerns and really come up with a comprehensive plan for how we're going to address things. And I always tell people that the luxury of primary care is that we can keep bringing people back for other appointments. So we don't have to figure it all out in one visit. We can, take time to address concerns longitudinally or over a long time period, so that we can do everything justice, so that we're not, so that we're covering everything adequately. And I think really feeling like all of your concerns are being addressed, maybe not in one visit, but over time, is really important for thinking. The other thing I like to recommend to people is that when they're bringing up concerns with their doctor, it's totally fine to be honest about what you're looking for. And I find that very helpful. In fact, sometimes I'll even ask patients if they seem, unsure at the end of the visit, what were you hoping, or did you have something you thought should be ordered or tested? And so if you're somebody who's coming in just looking for some reassurance that that pain on your side is no big deal, then let them know, I'm just looking for reassurance, or I'm really worried that this could be related to cancer, or my friend had a similar issue and wanted, ended up getting this test done. And I think that's really helpful for us, so that we can we definitely work on a plan that's going to be agreeable to both the doctor who wants to practice medicine in a responsible way, but also keeping in mind the needs of an individual.
Yeah, that's great. Thank you. You mentioned earlier chronic disease management is an important role for a primary care provider. What are some of those major chronic diseases impacting our population that you deal with, or that people can see a primary care provider for?
Right. Definitely, the big things we all know about: high blood pressure, high cholesterol, diabetes, some thyroid disorders come to mind as things we see every single day. And those are things that most primary care doctors can manage, unless they're very complicated, in which case then we would want to refer to one of our specialist colleagues to get help. And other things, though, that people don't always think about, acid reflux or GERD, we can definitely start that management process. Even sometimes lung disease, heart disease, we can get things started with patients, even though they might end up needing a referral for a procedure or additional testing. Screening for things like sleep apnea, and facilitating getting people the equipment they need for that. And then I also want to highlight, in terms of mental health, that a lot of primary care physicians will manage mental health conditions like depression and anxiety, which of course have increased abundantly, unfortunately, since the pandemic. And of course, October is the first week of October is Mental Health Awareness Month. So I think that's an important thing to plug, so that people are aware that there are lots of options that we can work with people to manage mental health conditions and get people feeling better. We actually, within MedStar, some of our sites have this what's called the Collaborative Care Behavioral Health Team, who assists the physicians and nurse practitioners with managing mental health conditions. And that has just been amazing for our patients to get more access to mental health providers, but knowing that our psychiatry colleagues and therapists are very overwhelmed right now. So I think there's just a full gamut of conditions, chronic conditions that we can assist very much with assisting to manage and really meet patients' goals. And the other thing you had asked, since we had talked about some advice, something to think about asking a potential primary care doctor is not only starting medicines and diagnosing conditions, but what about once they're really well controlled? How can we maybe think about cutting back on medicines, or stopping a medicine? And that's really important, because we don't do that enough. And I think it's one of my actual biggest joys, is being able to stop, say, a diabetes medicine for a patient, because things are so well controlled and they've made a lot of lifestyle changes. A lot of people also think about, weight and weight management, and there's a lot of approaches to that. And I think that's another important thing that primary care doctors can help with.
Yeah, that's great. I'm glad you mentioned, like you said, the mental health thing, and how going to your primary care doctor is a good place to start. Because sometimes I think that's for mental health or any sort of, chronic disease, it's hard to know where to start seeking this care. So I'm glad that you brought that up. That's good to know and important for people to know. I'm going to take a moment to pause and talk to our viewers. If you're just now joining us, thank you for tuning in. Today, I'm joined by Dr. Erin Hansen, an internal medicine physician with MedStar Health Primary Care, and we're discussing finding and establishing a primary care provider relationship and the benefits of having a primary care provider, including establishing critical baselines and treating chronic diseases. We have lots more to talk about, so stick around. If you have any questions for Dr. Hansen, you can leave those in the comments below. So getting back into the questions, how can a primary care provider help determine what are the right treatments for patients? I know you've talked about referring to different specialists, but can you talk just a little bit more about how you can work with your primary care provider?
Right. So if we have made, say, a diagnosis, we think about something like type 2 diabetes. And we also have our Diabetes Awareness Month coming up in November, which is a great time to think about, are you somebody who needs screening for diabetes, and just learning more about that particular disease. But say we've diagnosed type 2 diabetes. First of all, how severe is the condition? Is this something where we might be what we always want to think about lifestyle changes that can help, regardless of how severe a condition is. The lifestyle changes like getting more physical activity, eating a healthy diet, those can all make a huge difference in pretty much every disease process that you can think of. So that should always be mentioned as a treatment for the vast majority of conditions. And then after that, depending on the severity, is there a medication or multiple medications that we might want to use to help control this particular medical issue? And that is going to be, of course, our expertise in knowing about the medications and the disease process and keeping up with all the evidence and guidelines for what are the first line treatments. Beyond that, it's also thinking about in addition, or I think this is extremely important, is what are the individual patient's goals? If there's somebody who really doesn't like to take medications, we might want to try some other ideas, other lifestyle changes before we jump to a medicine. But then balancing other medications the patients are on, potential side effects, and then a treatment plan that's agreeable to the patient. So even though somebody might say need insulin right away because their diabetes is very severe at diagnosis, maybe that patient says, nope, there's no way I'm going to do injections every day. So then let's talk about that, and let's come up with a good plan for some other options that meet the person's needs, because that's always the most important. Is somebody going to be able to take the medicine? Is somebody going to be able to do an injection? All of those things. So I think those are the biggest things. And then having a plan for regular follow-up. When are we going to recheck lab work or check in about the medicine to see how it's going? Do we need to go up on the dose? You don't want somebody who's going to start at the lowest dose and then not increase it according to guidelines. So what is that plan going to look like? So those are all very important factors if we do decide somebody needs a medication or treatment for that. And then with a lot of disease, or some diseases, and diabetes is a great example, there are other screenings that go along with it. So do you need an eye exam? Have you had a foot exam? Are there other tests that we might need to think about? Other medications that go along to prevent long-term complications? And then having an idea of why we care about this disease, especially those diseases where people might not feel bad, and high blood pressure comes to mind. Well, why do we need to start a blood pressure medicine? I feel great. Well, we want to prevent long-term issues like heart attacks and strokes and things like that. So I always encourage people, don't be afraid to ask ask those questions to their doctor. Or if you have a concern about a medicine, maybe, especially I always try to talk about potential side effects with patients or things, but if you go home and Google the medicine and, see something that's concerning to you, ask your doctor about it, because they know not only about those side effects, but how significant they are or how that might apply to you personally compared with another person. And then the other thing I always urge people is, if you have problems with a medicine, say we start somebody on a medicine for diabetes and you're not feeling well on it, you notice side effects, don't wait 3 or 6 months to let your doctor know. Let them know right away, because they can make adjustments or recommend alternatives, rather than wait all that time and then bring it up at your next follow-up appointment, because we really want to help. We don't want somebody feeling miserable on a medicine, but we also want, if it's something that we're recommending to get some condition under control, we don't want to wait 6 months to do that. We really want to hear from patients about how they're feeling and how they're responding and feeling on a particular treatment.
Right. Yeah, that's good to know. Thank you for explaining all that. Are there symptoms to look for in potentially developing chronic diseases? I'm sure that might be a little all across the board depending on what the disease is, but is there certain ones that you would point out, to me or patients that might be like a red flag? You should definitely go see a doctor, go talk to your primary care provider to figure it out.
Right. No, that's a really good question. And it is hard because there's so many different disease processes and they all have different symptoms. But things, of course, chest pain, certain things we would want you to go to the ER, but you're having occasional chest pain, that would be something to let your doctor know. Some difficulty breathing. With diabetes, sometimes people notice that they're going to the bathroom, urinating, going to the bathroom a lot. They might find themselves very thirsty. Those are things that you would want to let your doctor know. Blood in your urine would always be very concerning. Anytime you're bleeding from somewhere you're not supposed to be bleeding from, that is a big concern. I always remind my patients who have reached menopause that if you have any type of bleeding at all, even if it's just a little bit of spotting, that is never normal, and you need to let me know right away so we can order the workup. So, and to be honest, I just say anything that's worrying you, just talk to your doctor about it and schedule an appointment. Fatigue is a very common concern, joint pain, and even if it's not something that maybe there's a lot of causes of those types of symptoms, and it's our job to ask the questions and learn about what types of testing we might need to do or how we might address that concern. So I think you should never be hesitant to bring something up to your doctor, and we've heard it all, so nothing is going to be surprising, or sometimes people are embarrassed to bring things up, but I promise you we've heard and seen it all, so it's rarely a surprise, or rarely something we've never come across before.
Yeah, I know it can be tough to, you have these little issues that might be kind of concerning to you, but it's easy to push them off, or say, it's nothing, and then one day it might be something. So it's better to talk about that with your doctor before it turns into something bad, or just like you mentioned earlier, to get that reassurance that no, you're okay. But it's better to say something than just sit with whatever your pain or whatever it is. And once again, this might be a little dependent on what the disease is, but how can everyday habits control the treatment of chronic diseases? I'm sure, like I said, could be depending on what the disease is, but there might be some overlap as well.
Right. Well, of course, physical activity is always recommended. It helps not only with physical diagnoses like high blood pressure and diabetes, controlling blood sugars, helps with things like joint pain, which sometimes is counterintuitive, but the more we move and use our bodies, the better that feels, preventing headaches or migraines. Physical activity is great. Mental health, helping with mental health. So it's a rare issue that is not helped by physical activity. And I like to tell people that physical activity does not have to mean going to the gym and doing such and such amount of time on the treadmill and then doing whatever weight training. Every activity is helpful. So dancing is great physical activity, getting out for a walk, even if it's, you might have to do frequent 10 minutes here and there, it all adds up and is beneficial. Going for a bike ride with one of your kids, those are all great. And it doesn't have to be one specific idea. We don't need to let the perfect be the enemy of the good. And something is always better than nothing. So if you're like, you know what, I've only got 10 minutes to go walk around the block on my lunch break, well, great, that's better than doing nothing. So I always tell people that as well. There are plenty of seated exercises that people can do if they have some mobility limitations or find they have balance issues and it's hard to get up and walk, for example. And then I also encourage people sometimes to do some core strengthening and weight training, not because we are looking for abs, six-pack abs and tickets to the gun show, but just because it helps long term with retaining that muscle mass, helping balance, being able to do all the things that we want to do as we start aging. And it's our job as primary care doctors to look ahead 20 years and set people up for success. So that's one thing, physical activity. Of course, eating habits make a big difference. I think it's worthwhile always to have a conversation with your doctor about what might be a good eating plan for you. Limiting salt, watching, if you have diabetes, watching your carb intake is very helpful. Sugar intake, those are things that everybody can do. And then of course, other habits like smoking. Primary care doctors can help you with quitting smoking and helping you have enough resources to support that. And that is so many huge benefits for quitting smoking, no matter how long you have been smoking cigarettes or using tobacco. Limiting alcohol, limiting caffeine, all of those things can make a big difference with long-term health and wellness. And then, thinking about just other things. Are you doing things that you enjoy doing that bring joy to your life? And that's so beneficial for mental health as well. So those are some things that quickly come to mind for regular day-to-day activities that can really make a huge difference. A lot of people are worried about weight loss and have these ideas that they, just need to go and lose, crazy amounts of weight. But really, just 5 to 10% of body weight can have huge health benefits. But even beyond that, I think rather than looking at a number on a scale, looking at other health benefits as a goal. So if I make this change, if I move my body more and get more physical activity, my blood sugars will be better and I will feel better in terms of my, depression or anxiety. And thinking about that goal as opposed to just a strict number on the scale, because I think that can be helpful because people can be healthy or not healthy with any shape and any size of body. And really it's what are your health goals? What things can I do that will work on improving this particular condition?
Yeah, that's a super important point to make. What you mentioned screenings previously. What are some of the common preventative screenings that are offered by primary care providers, and why are these screenings necessary?
And that the preventive health matters a lot based on somebody's age. Really depends a lot on what types of screenings. Somebody's gender will also impact what we're recommending for screenings. So certainly, generally, we'll be screening for high blood pressure at every visit when we do the vital signs at the beginning of the visit. So that's one thing that nearly everybody is going to get in the office setting is a blood pressure screening. Often screening for certain chronic health problems depending on your age and other health conditions. As appropriate, screening for high cholesterol, screening for diabetes if you have certain risk factors. If you have maybe screening for liver disease with certain characteristics of a patient or certain risk factors or certain medicines. So there's a number of disease processes that we might screen for. Other common ones, of course, are cancer screenings, and those vary based on age and gender, of course. And so breast cancer screening, most people know about colon cancer screening, and then cervical cancer screening. And for anyone out, if there's anyone watching who is transgender, making sure that your doctor is aware and making sure that they're ordering the appropriate screenings based on the assigned sex at birth and any surgeries or other measures someone has taken to align themselves with their gender identity. That's very, very important. Lung cancer screening exists for people who have been smoking for a certain amount of time or have quit within a certain amount of time. So that's important as well. So I kind of break it down into sort of disease-related screenings, cancer screenings, thinking about vaccines and immunizations as part of preventive health. And I always tell my patients, it's my job to let you know what you're eligible for and what my recommendation is. But at the end of the day, it's your decision what you want to proceed with, what testing and everything. So for after a certain age, we do bone density scans to look for osteoporosis or bone loss. So there's a whole gamut of things. And then if you look at a lot of our guidelines come from something called the U.S. Preventive Services Task Force, and then other medical society guidelines. And so there's a whole slew of them. And of course, it wouldn't be realistic to cover every single one at every single visit, but it covers everything from screening for hepatitis and HIV to preventing skin cancer, et cetera. So it's very broad. The other thing I was going to mention is sometimes it gets confusing and a little frustrating for patients because the guidelines vary depending on which set of guidelines you're reading. So breast cancer comes to mind, where different medical societies and the Preventive Services Task Force have different guidelines. So that's where it's important to talk to your doctor and really find out why they're recommending starting at a certain age, or why they're recommending spacing out the screenings, which guidelines are they following, and not to get into the weeds, but just because there's so many sometimes conflicting guidelines that it gets very, very confusing. So I appreciate that patients get frustrated and concerned about that when they hear different things from different people.
Yeah, which then I'm sure that also ties into the importance of having an established relationship with your primary care provider, because they know what kind of screenings you should get. And, I know that a lot of the screenings, like you said, you get them at this age or whatever, but it's this age, or if you have a history, or if you have this, you should get it sooner or later, whatever. So having that guidance from your primary care provider based off the guidances that they're given and your relationship with them can be super helpful and super important, one of the benefits.
Right. And we also know, of course, what you've had done and what you haven't had done.
Right.
So we possess all of that information, so we can let you know, hey, it is time for you to do another pneumonia vaccine, or what, you're done for now. Even if they ask you at the pharmacy, you don't need one right now.
Yeah.
So we aren't doing any unnecessary testing. And I always tell patients, I'm never going to recommend a test that isn't necessary or recommended based on the guidelines and everything. We're not doing testing just for no good reason.
Yeah.
And so I recommend, if anybody approaches you about a screening program, to make sure that you talk to your doctor about that first before you undergo any unnecessary testing that might cost you a lot of money, because we're gonna do right by you, and we're gonna make sure that we're recommending only what's relevant for you as an individual. And then I just like to plug, because I really enjoy women's health, and that's one of my interest areas. A lot of women don't realize that their primary care doctor can order their mammogram, and some of us do cervical cancer screening and can do exams to check for sexually transmitted infections and things like that. So it's definitely, going back to one of the original questions about what you're looking for, if that's important to you to have someone who can do that more comprehensive healthcare, then definitely ask those questions when you're setting up with them.
Yeah, that's a great point. So scheduling an appointment, that's the first step to getting an appointment. Sometimes for me, the biggest hurdle to actually getting to scheduling that appointment. Can you talk about the appointment options that we have, and kind of how we can, patients can go about scheduling appointments?
Right. That's Great, great, great question. And I will preface this by saying I understand that it can be very frustrating to try to get set up with a new primary care doctor because we are in such demand right now. Thankfully, a lot more people are engaging with primary care and have insurance that allows them to see a primary care doctor regularly, which I think is so fantastic. But then, of course, that means there's more people who are looking for primary care doctors. So don't give up. If it turns out it might take a little longer than you were hoping to get in to see someone, just make the appointment because it will be here before you know it. We do unfortunately have a shortage of primary care physicians in this country, but and some of that's, people retired because of the pandemic and things like that. But we have so many other providers that are now joining the primary care workforce, like our nurse practitioner colleagues. So there are there's some variety of options that maybe weren't there so much in the past. So in terms of how to schedule an appointment, of course, there's the old fashioned pick up the phone and call and get an appointment that way. But thankfully for technology, we have within MedStar ways of scheduling appointments online, which is really terrific. And then I would say for a first visit, definitely I like to do those in the office, and they should be done in the office. So that way we can meet face to face, check blood pressures, all of those things. And do an actual physical exam, because that's very challenging. And certainly you can't listen to anybody's heart and lungs over a telehealth visit. But after you're established, then you can do telehealth visits especially within MedStar, and which is really great. We want to do it for the right types of visits, but it's a really great way of being able to have that appointment, but not necessarily have to come into the office. So I think sometimes the routine follow-ups, we're just checking in about your diabetes numbers, and you've been able to get me your log sheet ahead of time, and we're really just talking about the lab work. That's a great way to avoid having to come into the office and increase your access, especially for people who have mobility concerns or transportation issues, and it's harder to get in. There are some more acute or illness-related complaints or concerns that we can do for telehealth. Not all of them are well suited for that, but some of them are, and our schedulers and our clinicians definitely help us decide that. Certain visits like physicals and pre-op appointments do need to be done in person, but that's something to ask about when you're trying to find a new doctor is, do you have telehealth visits? Because that has been really wonderful for a lot of people to be able to use those types of appointments. And then in terms of MedStar specifically, we have this great feature called e-visit that's available for both already existing patients, but also our new patients as well. And it's an on-demand telehealth visit option. It's 24 hours a day, 7 days a week. So you wake up in the middle of the night and you have really horrible back pain, and you really just you want to have an appointment, that option is available to you. So that's really nice, and you can schedule the appointments online. So it's very convenient for people. So we have some really great technological advances in the last few years that really have helped expand access to healthcare. And then the other thing I want to mention is, while sometimes it takes a while to get in to see a new primary care doctor, once you're into the practice, then it becomes easier to get in to see them again, or to access them if you have questions in between appointments and things like that. And then once you're established, putting in orders, one of the things I always like to do, and I think most of us, my colleagues and my partners, is to order labs in preparation for an appointment. And so that's easy to do within a system like ours. So that way we have the results back and we can talk about them face to face during the appointment, rather than having to wait and talk about them later over the phone. Patient portals are really helpful for scheduling appointments, and we have a great one with MedStar. I tell my patients, I have used a lot of patient portals as a patient, and I find ours to be very easy to use. But scheduling appointments, requesting prescriptions, just sending a message, being able to send a message and say, hey, I've got this symptom. Do you think I need to be seen, or should I go see a specialist, etc. So that's really wonderful as well. So something else to ask when you're thinking about a new doctor: is there a portal? How do you get in touch with patients? And then the other thing I would say too, when you're getting started with someone, is asking, when something comes up, am I going to be seen seeing you? Am I going to be able to see someone else if you happen to be booked up, et cetera? So that's really important, because you want to make sure, even just thinking about how long it takes to get an appointment just for that new visit, what's going to happen after I'm already in the office. But once you're in, then it becomes much, much, much easier to get an appointment with your doctor.
Yeah. And I'm glad you brought up telehealth, and because that was going to be my next question. And I think it's good to know, because I feel like a lot of people after, things started opening up after COVID, it was, you kind of felt like that wasn't an option anymore. That was just a COVID thing. But it's not, it's still there. It's still available. And like you said, there's a lot of things that you do still need to go in person to meet in person with your doctor, but there's a lot that you can do over virtually, and it makes your life a lot easier. I know I have some appointments that I do virtually, and it's saved me a lot of traveling, a lot of time just to have a quick phone call or Teams or video call with the doctor. So I'm glad you mentioned that, because it's important for people to know that that is still an option, and there's, like I said, a lot of appointments that you can have virtually.
Yeah. And we're very good about guiding people for what, and some of that's going to be physician preference as well.
Right.
I really, often when somebody has a respiratory or lung related complaint, I want to be able to bring them in and listen to their lungs, because that still has some value, even in the age of all of our technology. And so, we will certainly try to work with people and do video visits or telehealth visits to the extent possible. But sometimes you just need to be able to see someone and actually examine them in person. And so definitely, if your doctor is recommending it, it's not just because they want to inconvenience you. It's because we think there is still value in physical exam.
Yeah, good point. My last question, just to wrap up our broadcast, what is the message you hope our audience will take away from watching this? Or is there anything that you would like to point out that we didn't go over?
Yeah, I think the big take home is that primary care is important for everyone, and that your primary care doctor just fills so many functions as part of the team of people that take care of you. We can help you meet all kinds of different health goals, manage your chronic diseases, do all of those preventive health screenings, and then help to coordinate with various specialists. So we really are, and we want to be your home base for healthcare. We want to be the first person you reach out to when something comes up. And then the other thing is, just that human aspect of it, having somebody who knows you, who is aware of what's going on with you, where maybe something happened in your family and you've got that person who can support you through that. And a lot of us, we people who go into primary care generally really care, and all doctors do, and nurse practitioners, but we really think about the whole person and all the factors that go into who they are and what's affecting their health. So we really want to be there and support people.
All right, well, that's a perfect way to wrap up our broadcast. Thank you again, Dr. Hansen, for joining us and taking time out of your day. Like I said, really appreciate it. And thank you to all of our viewers for watching. And we will add a link in the comments for more information about MedStar Health Primary Care to learn more, to schedule an appointment. So thank you again for joining, and we'll see you next time.
My pleasure. Thank you, everyone.
Thank you.